them and all that. Okay. So first we have comparison of choroidal thickness in hypertensive patients with healthy individuals using OCT, right? Okay. By Dr. Jaimy and Philip. Over to you.
Good morning, everyone. Today, I would like to talk about the comparison of choroidal thickness in hypertensive patients with healthy individuals using optical coherence tomography. We all know that WHO defined hypertension as a systolic blood pressure more than 140 millimeters of mercury and or a diastolic BP of more than 90 millimeters of mercury. It's unfortunate that more than 46% of the adults they are unaware of having this condition, and many present to us with target organ damage. Hypertension causes ocular abnormalities like choroidopathy, retinopathy, vascular occlusions, and optic neuropathy. Keith Wagner has graded hypertensive retinopathy into 4 stages. Stage 1 with arterial narrowing, stage 2 with AV nicking changes, stage 3 with hard exudate cotton wool spot hemorrhages, and stage 4 with optic disc swelling. We know that choroid supplies the outer layers of retina, and when microvascular injury caused by hypertension affects them, there will be retinopathy and alteration in the choroidal thickness. And by the emergence of optical coherence tomography, we can detect these changes and the alteration in the choroidal thickness. And since the ocular changes of hypertension precedes the systemic changes, this helps in early detection, management, and monitoring of hypertension. We did a prospective descriptive cross-sectional study in the patients coming to retina clinic of our department. The sample size was 31. That means we studied 62 eyes of 31 patients, each in hypertensive and the control group. We included patients of more than age more than or equal to 18 years and those with clear ocular media, and excluded those with diabetes, then disease affecting the retina, those with hazy media and glaucoma. After obtaining the written informed consent, we did BP measurement, visual acuity measurement, then indirect ophthalmoscopy, and finally we did an OCT scan on them. We measured the choroidal thickness in 3 locations, that is subfoveally, then 500 micrometers nasal to the fovea and 500 micrometer temporal to the fovea. And this is how we measure the choroidal thickness. That is a perpendicular distance between the hyperreflective outer border of the RP Brooks membrane to the sclerochoroidal interface, and it's done by a single observer. Finally, the data entry was done and analysis was done using the SPSS software. And among the 62 patients we studied, 20 were males and 42 were females, and their mean age was 49.47 plus or minus 9 years. The mean duration of hypertension was 3.67 years, and among the hypertensives, 22 subjects had hypertension for less than or equal to 5 years, and 9 patients had hypertension for more than 5 years. We found that the choroidal thickness in subfoveal region was similar in hypertensive and the control group, whereas the nasal and the temporal choroidal thickness was significantly reduced in the hypertensive group compared to the control group. However, the subfoveal choroid was thicker than the nasal and the temporal choroid in both the groups. We also found that the SFCT in hypertensives had a weak positive correlation with mean BP, and nasal choroidal thickness had a weak negative correlation with the mean BP. These were some few studies in the past which had similar results. We had some limitations, that is, we had a relatively small sample size. The measurement of choroidal thickness, it was done manually, and there was no long-term follow-up. We concluded that the subfoveal choroidal thickness is similar in both hypertensives and control group. Then the nasal and the temporal choroidal thickness was significantly reduced in hypertensive, and the subfoveal choroid was thicker in nasal, thicker than nasal and the temporal choroid. Thus, the measurement of choroidal thickness by OCT can be used as a non-invasive biomarker to assess the effect of systemic hypertension on the eye. These were references. Thank you.
Okay, so as ma'am was just telling, you finished perfectly on time. So that is also very important when you go for a competitive session. And congratulations on this study. One thing I would like to ask us about the sample size, as you said, it is very small. But one place you have mentioned 62 eyes of 31 patients, one place you have mentioned 62 patients. So just make sure that you don't consider 62 eyes as 62 patients. Okay, make sure those things are always correct. And how did you calculate the sample size?
It was 2 into 4 into standard deviation square divided by d square.
Okay, so this is with the help of a statistician, and you
Yes.
have got data from previous studies, found out how much is required to show a significant difference,
Yeah.
and calculated. Okay.
And a good study, Jamie. But I think your introduction should be little more to the topic of your study, because you have given a broader introduction as a hypertensive changes. No, so how to measure? How other you have told in the limitation that you have used manual method for measuring the thickness. No, so how are the other studies measured and all? You have to discussion you can include, and what is your interpretation, and how you can extrapolate, even though your sample size is small, how you can extrapolate in the larger population. So your introduction, everything you should stick to the study. So that should be kept in mind. Okay, good.
That was a good study.
Thank you.
It is good, but then one thing is always have one slide of no financial interest and no conflict of interest. Whenever you go to a competitive session, that is one must, because you don't need to have any kind of conflict of interest between anything. So one slide, no financial and no conflict of interest, and then like ma'am said, more about what you are talking about. We don't want to know the whole of hypertensive retinopathy. What is your topic, and something related to that would be good, an introduction, and then discussion. It would be better if you put a tabular column on your study comparing with other study what they have done. That will give a more clear picture of what is
Can you
happening.
go back to that slide,
Yeah.
the discussion slide?
Yeah. So you can actually make this into a proper tabular column, having your study and comparing with what other people have done, how much sample size they've taken, what are their methods, and and even I think you could have even correlated choroidal findings with the thickness also in this study, isn't it?
Yes.
Even the hypertensive retinopathy grading could also be made into a small graph, so it would give a better picture on whatever you're talking about.
And make sure there are no spelling mistakes. Fourth sentence, I mean, fourth point, temporal, there is a missing P. Okay, so
Yes.
always proofread your presentation, and many times, if you go through it several times, also you'll miss it. You ask somebody else to proofread yours, because you look at it with fresh eyes, you will find more mistakes. Can fix that. And like Dr. Prithvi said, discussion is quite an important part of the presentation. And once you show your results, you compare with other results, and you tell, okay, in my study it came like this, in the other study they showed this, and you can give your hypothesis on why your study is showing a different value, if so. Okay, so that will give more value. Like your study was done on this population, so perhaps this population has more of this, or that study they measured using a different technique, so that shows a different thing. So something like that also would be important to mention.
Exactly, because you need to explain what is so different in your study, what is different, so different that a judge should, give you marks based on that. What is the other review studies which you have done, and how your thing is different, and what something new you're adding to the pool of literature that carries a lot of marks.
And always you think, what is the purpose of this study? What is the impact of this study? After seeing this study, will it change something? So now your study has definitely that, no? You're going to say that this can be used to find out the hypertensive effects. So that is something which you have to stress there. After this study, you're going to say that this is going to be a new method for looking at. So you
Detection.
can stress that point. Can you go to this picture where you show the OCT and where you're measuring? There you have not shown the measurements. Okay. So if you showed the measurements like where it is measured, choroidal thickness, that would also be nice. This was measured using the OCT software itself, correct?
Yes, sir.
So you have put 500 microns this side, 500 microns that side, but you have not shown the measurements.
Okay.
So that also has to be added. Okay.
Mm. Inbuilt software.
No, manual measurement means on the OCT you draw the lines manually, no? So that is not, that is not worse than inbuilt measurement. Inbuilt measurement means it will try to detect the margins by itself. That is the only thing it does, and that is often wrong. Okay, so manual is better. So if you want to stress that, our study uses manual measurement, so it is better than automated measurements. If you want to, you can say something like that. Not really recommended, but yeah. So you can actually show the measurements here. Okay.
This was the image you took.
Yeah.
This is from your study. Okay, so then you should definitely have the measurements marked there. A few sample of your data should be there. So I think that was a very fruitful discussion. Yeah, so Dr. Jaimy, you get a certificate of presentation. And we hope that you publish the study or you do further work on the study and present it also.